We've got Dr. Shabbar Danish on the line. Dr. Danish is a neurosurgeon from the Robert Wood Johnson University Hospital in New Brunswick, New Jersey. Dr. Danish, are you there?
Yeah, hey, how are you?
Oh, I'm good. Thank you so much for taking time on your Saturday evening. It's a pleasure being able to speak to you, and as you know, we've spoken on the air before. And Dr. Danish is the chief of neurosurgery at the Rutgers Cancer Institute of New Jersey. He is the director of stereotactic and functional neurosurgery. A lot of big words at Robert Wood Johnson. And the director of the Gamma Knife Center at Robert Wood Johnson. So we've got him on because there's something new at Robert Wood Johnson. There always is, it seems, something new every week. But now it's the first hospital in New Jersey to offer what's called the Leksell Gamma Knife Icon. And I want you to tell us what this thing is, Dr. Danish.
So Gamma Knife Icon is the next upgrade for Elekta's radiosurgery machine for the brain. The advantage in this technology is that things that we couldn't do before with Gamma Knife we're now able to do. Certain kinds of tumors, certain sizes, certain locations. It now offers us a frameless solution, and so and the physics has improved, and so the accuracy of the treatments has improved. And so I think that it's a commitment of the health system to neurologic disease, and it's great that we're able to sort of pave the way for the rest of the state.
Okay, now Dr. Danish has been on before talking about technologies like this, and he is I want to let you know, he is a world leader, not just a New Jersey or regional leader, but a world leader, and we are so happy to have him at Robert Wood Johnson at the Rutgers Cancer Institute. And I know that you have patients come from all over the world for your very unique treatments, and you're teaching surgeons from all over the world your new techniques that you have developed, and I want to thank you for that. And just a personal note, Dr. Danish was my mother's physician and did a wonderful job, and I want to thank him for that. So, but tell us now, if someone has a brain tumor, at what point do you operate on a brain tumor, or at what point do you use this Gamma Knife?
Well, I think the patient who's appropriate for surgery versus the patient who's appropriate for Gamma Knife sometimes overlap and sometimes don't. Some tumors that are deep in the brain, tumors that we know that are responsive to high-dose radiation are much more appropriate for Gamma Knife radiation versus surgery. And I think probably the most important message, from that question is that you want to go to somebody who has a good handle on both, or you want to go to a system that has a good handle on both, so that you can get an objective opinion for whether the problem and or the tumor that you have is amenable to one, the other, or both used together.
Okay, so let's say it's determined that the Gamma Knife is the appropriate treatment for someone. Now, what about this? What is this new? This is an amazing title here, Elekta's Leksell, I can't even pronounce it, Gamma Knife. So tell us about this brand new system. How is it different than the one you used, let's say, a year and a half ago? So
the major difference in this technology, so first of all, especially in the Northeast, there's a lot of radiosurgery tools. So Gamma Knife is the only tool that's designed specifically for the brain. Everything else is retrofitted or has an attachment. The brain is the only thing the Gamma Knife treats. Now, what the Icon has, it has an onboard CT scanner that allows for real-time realignment of the beams that are being used to treat the patient. So you can realign it with the CAT scanner. It improves the accuracy, in fact, improves the throughput to make the treatments much more comfortable, in fact, much faster. There are instances in which the types of tumors and the number of tumors or pathologies that can be treated at the same time or in sequence can be improved as a result of not only the onboard CAT scanner, but the ability to do this framelessly. There are some patients who just can't handle the idea of having a frame fixed to their skull, or just are not appropriate. So the advent of the frameless solution with Icon allows us to bypass that so that we can offer the same accuracy in treatment without having to put those patients in a frame. It ultimately leads to better patient comfort.
My guest this evening is Dr. Shabbar Danish, who is a neurosurgeon. He's the chief of neurosurgery at the Rutgers Cancer Institute and a world leader in, absolutely no pun intended, cutting-edge therapy for brain tumors. And there are so many options now for brain tumors that we didn't have. I mean, you're a young guy, but, I went to medical school in the 70s and 80s, and, boy, I'll tell you, there weren't too many options. And it's so incredible to see these advances. And it seems every couple of years now, things are progressing more and more and better for patients. So how many people can benefit from this kind of new technology?
Well, I mean, just in the tumor world alone, there's almost 80+ thousand new cases of tumors, and today probably more than 750,000 people are living with primary and secondary brain tumors. And so, and that's just part of what the Gamma Knife does. The Gamma Knife treats functional disorders like essential tremor and Parkinson's disease. It treats pain disorders. It treats vascular disorders such as arteriovenous malformations. So there's a large number of patients who potentially can take advantage of non-invasive therapy. They can come in and out the same exact day and be completely cured of their ailments without ever making an incision.
So let's recap for just a second. In the old days, which was about a year ago, you had to put a frame, which was a metal thing on the head. It's screwed in, kind of a nuisance, but still, a lot better than surgery. With your old system, you don't need a frame anymore. You said, right?
That's correct. This new system can bypass the frame for patients who can't tolerate it or are just not appropriate.
Well, also, it shortens the treatment by, about an hour and a half? Because I remember that was a big part of the treatment. You had to have the frame put on, and then you were...
so one of the major advantages is we can do all of the planning imaging outside the frame in advance of the day of treatment. And so all of that can be done with a lot more comfort for the patient. And then when they come in, we just put them on the machine and treat, so we don't have to do any of that pre-planning MRI on the day of treatment. So as a result, the patients spend a lot less time, in the center and going through the machine.
An amazing development, and I want to thank you for being one of the leaders in the world doing this kind of cutting-edge therapy for brain tumors. Dr. Shabbar Danish is a neurosurgeon at the Robert Wood Johnson University Hospital. If someone has a brain tumor and they're trying to understand what kind of treatment to get and they want an opinion from the folks at Robert Wood Johnson, who do they call? What's the phone number?
Well, I think that they can either call the Rutgers Cancer Institute at 235-8515, or if you just call the main number at Robert Johnson University Hospital, they'll be able to put anybody through to us so that we can see them fairly quickly.
And the main number is 888-MD-RWJUH. That's 888-MD-RWJUH. There's a website, great website, rwjuh.edu. That's rwjuh.edu, and you can go on that website and learn about this and other treatments at Robert Wood Johnson. Dr. Danish, I want to thank you so much for taking time on your Saturday evening. Your time is so valuable, so thank you so much.
Dr. Perry, thanks a lot for having me.
Okay, and stay tuned. There's more to the show. We will be back after these words. 800-848-9222, 800-848-WABC. We'll be right back.
I've cut way back on salt.
And I eat lots of salmon and broccoli.
I exercise to lower my blood pressure.
Because you're so stressed.
Because I try to do everything I can to be around, for me and for you.
When we take care of our own hearts, we're also taking care of the people closest to us. So it's comforting to know that RWJBarnabas Health has New Jersey's most comprehensive cardiac care program, with access to top specialists, minimally invasive heart surgery options, and rehabilitation and wellness programs that strengthen and protect hearts. We're also home to the state's most experienced valve replacement team, and we're one of the nation's top 5 heart transplant centers. So get your heart checked. It's as easy as visiting rwjbh.org/heart for an appointment.
I plan on being around for us a long, long time.
Me too.
Your heart doesn't beat just for you. RWJBarnabas Health. Let's be healthy together.